It's become a way of life around the world for more than a year now. Face masks, lockdowns, and closed borders. And many countries are still battling the spread of COVID-19, some with record numbers of infections and deaths. With an easily transmittable virus that knows no boundaries, vaccines have become the main focus to effectively slow down the surge in new cases. China, where the virus first surfaced at the end of 2019, has been developing and administering several vaccines, but they have yet to be approved by the World Health Organization.
To have the vaccines approved by WHO would be one of the indications of a rising power or this rising application and influence in global politics.
According to China's foreign ministry, vaccine assistance is being provided to 80 countries with exports to more than 40 others. But it is eager to get WHO approval for the 2 Chinese vaccines. It would open the door for overseas travel, although with caution. As the inoculation efforts step up, around the world, vaccine approvals could be laying the groundwork for what could be seen as a global vaccine roadmap, where the shot you get could determine which countries you can travel to. The European Union is considering a vaccine passport system where only certain approved vaccines qualify, which means those inoculated with the Chinese-made doses would be barred from entry.
China is now so integrated in global market and also global trade. Without the vaccine being approved, it could be possible that the flow of capital, the flow of labor, and also investment that China has overseas and foreign investment into China will all be affected.
But experts say approval could also pose a dilemma. Once China formally joins the global supply chain and collaborations like COVAX to supply poorer countries, it will need to ramp up production. It then has to fulfill international commitments and its own domestic targets. So far, not even 20% of China's 1.3 billion people have been vaccinated. Divya, Gopalan, Jazeera, Hong Kong.